This conference will now be recorded.
Lieutenant Governor, Joe Minor, I move we approve the minutes from the December 16th meeting.
Thank you, Dr. Minor.
This is Brian Steed, I second.
Thank you, Brian. Any discussion? Hearing none, all in favor, please say aye.
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 Aye. Aye. And any opposed? Okay, I will rule that the motion carries unanimously. Let's go ahead and move on to the next item on the agenda, the earthquake declaration, individual assistance. Janna Wilkinson is going to take that for us. Janna?
Thank you. I'm Janna Wilkinson. I work for Division of Emergency Management. I'm the state's individual assistance officer. And oh, there we go. Waiting for that to switch over to me. Oh, it looks like Janna has the presentation up. Were you going to switch it to me, Janna, or do you just want me to tell you when to change the slides?
I'm trying, but maybe just tell me to change slides. Sorry, I'm not an expert on GoToMeeting.
That's okay. If you just want to go to the next slide, we'll start with the first one. I'm going to give you just a little overview over FEMA's individual assistance programs and what has been activated in Utah. And when we do a federally declared disaster, FEMA comes in with two general programs that we use: public assistance, which I believe I'm not sure if Brad's talking about public assistance and mitigation. That's for public infrastructure, so repairs to public infrastructure and damage to public facilities. And then FEMA's individual assistance, or IA program, is what helps individual residents and small businesses with any damages or repairs that they have during the recovery process. Underneath individual assistance, there are two types of programs. One is a community service program. So these are grants that the state can get to start and run a program, or they're funding that's directly administered between another federal agency and a state agency. And the programs that fall under that are disaster unemployment assistance, legal services, crisis counseling, and case management. We currently have all programs active for the earthquake, with the exception of case management. FEMA has tried to increase the case management or the assistance that applicants receive on an individual basis to help them navigate all their options and the FEMA systems in their application process. And so they're trying to integrate that more virtually so that we wouldn't have to request and start a separate case management program. We have 90 days from the July 9th declaration date to decide if we do want to stand up a program. And case management and crisis counseling are both programs that we as a state apply for a grant program fund from FEMA. They pay 100% of the cost, and then we stand up a state level program to provide crisis counseling and case management. Crisis counseling, we don't currently have active for the earthquake. We were approved to do crisis counseling if we would like to, but we already have a large grant and a large statewide robust program due to a COVID approval for a crisis counseling program. And so our Division of Human Services just decided that it was best to work within the program we already have, right, rather than try to create a secondary program. And legal services is active. We're waiting on a hotline. A Young Lawyers Association handles that. They work directly with residents to help them with any legal issues they might have directly related to the earthquake. So it could be disputes with landlords, it could be disputes with insurance companies, or other issues that they may have and need advice on. That is paid for 100% by FEMA. And then disaster unemployment assistance is activated through FEMA, but that comes through the Department of Labor. So once it's activated and we request that program, Department of Labor works with our unemployment division to provide that service. And we do currently have that service active for residents on top of the COVID CARES Act unemployment that was provided. The other program is the Individuals and Households program. And Individuals and Households looks at providing assistance to residents to repair their homes' damaged structures and property losses. If you go to the next slide, Janna, I'll go into more detail on those. So it's a lot of text, so I'm not going to read it to you, but these are the three community service programs we currently have active, assisting residents under COVID. It explains a little bit of what I've already explained to you, and then has the links for the information on where residents need to go to access these resources. This slide can be shared as a resource with participants in this meeting if you'd like to have that. We also have a printable PDF form if you'd like to have the slides for that. Janna, if you'll go to the next slide, we'll get into the Individuals and Households program. So Individuals and Households program has several sub-programs. The first one is Housing Assistance. So FEMA can come in after we've received a federal declaration and they can provide financial assistance for housing, which means that residents apply to FEMA, FEMA assesses damages or losses, and then they can provide payments for things such as lodging reimbursement. So if they had to evacuate their home and stay in a hotel due to damages, or if they need rental assistance for temporary housing while their permanent home is being repaired. And they can also provide money to repair or replace damages in your primary home. One note on that is that when they do repair and replacement with homes, FEMA's primary focus, as they are nationwide, there's a lot of residents that need help. They focus on making the home safe, sanitary, and functional. So when they give payments for repairs, it's to provide basic necessary repairs. So if you had a crystal chandelier that was shattered in the earthquake, they would not give you a check for the cost of that crystal chandelier. What they would do is provide you funding to replace that light fixture with a basic light fixture so that your light can be functional, your home can be functional with light fixtures. But it's not the full cost of those individual tastes or decorative items that we have. It's safe, sanitary, and functional. They also do direct housing. So direct housing is where they don't provide residents with funding, but they take care of arranging the housing. And that can be lease and repair. So FEMA might lease a full building, an apartment building, refurbish it, repair it, and then temporarily house residents there. They can do transportable temporary housing units. Oftentimes we call them manufactured housing units, or they can use RVs and provide those, and then direct lease. And then they also can provide permanent housing construction. So if an area is completely decimated of housing, they can help with building new housing. A lot of times this can happen in really rural areas. I know Alaska has had some of that permanent housing construction, and FEMA basically pays for items to come up instead of providing the residents with the funding. Now, direct housing does require a 25% state cost share. So financial assistance is 100% funded by FEMA, but direct housing does require that we provide a 25% state cost share with the total of that program. You go to the next slide, Janna. Another program under the individuals and households is what's called Other Needs Assistance, or ONA. There are two types of ONA. One is non-SBA dependent and one is SBA dependent. So SBA is part of the IHP process, and I'll talk about that a little bit more later. But the non-SBA dependent are items that any resident who applies for FEMA, if they have eligible needs, they can get those regardless of whether they can qualify for an SBA loan. The SBA dependent items, which are personal property and transportation, are dependent on whether the resident can qualify for an SBA disaster loan. If they qualify for an SBA disaster loan, it's expected they'll use that loan to help cover those. And if they are denied or ineligible for an SBA loan, then they could receive additional assistance from FEMA on those two items. ONA is another program. So there's two programs under all of the individual assistance programs that require a state cost share. And that's the direct housing and then these ONA costs as well. And every year we fill out a form that outlines what childcare, medical, dental, and funeral costs within the state of Utah are, as well as outlining what it would cost to replace a basic transportation vehicle. So we update those annually to try and keep them accurate. And we also have an opportunity to review them and any other miscellaneous items that we would like added to the ONA within the first, I think it's 48 to 72 hours after a disaster. So we try to stay on top of this so we're prepared when something comes into play. Next slide, please, Janna. So SBA disaster loans, they actually provide a large portion of the financial assistance that residents can receive after a disaster. FEMA comes into play after insurance, and then SBA is part of that process. And once they've gone through the steps to register with FEMA to have been approved for non-SBA dependent items, FEMA asks residents to register with the SBA. to see if they can qualify for a low interest disaster loan to do the repairs and replacements on their property. Individuals and families can qualify for up to $200,000 to repair or replace the property, and $40,000 to replace lost personal property. And renters can apply for up to $40,000 to repair or replace their personal property. Businesses can also apply if they receive damage during the event. They can apply for up to $2 million in repair for their real estate or equipment and any inventory that was lost. They can also qualify for economic injury. This is the one that we've seen active in COVID. It was one of the bigger SBA disaster loan programs that came out initially, was businesses applying for economic injury who had had adverse financial impacts due to the disaster. You can go to the next slide. And I guess one note on SBA as well is that if a resident does have damage to their home, or a business does, they can use SBA to take out an additional amount to do mitigation on that home. So if they need to mitigate it to bring it up to safer disaster standards for either earthquake or flood, they can use some additional funds to cover that. You can also take out an SBA loan as a homeowner if you have disaster insurance, but you need assistance covering the deductible. So if you had earthquake insurance, but you had a high deductible, you could take out an SBA loan to cover that deductible to make the repairs on your home. This is just a brief overview of how the Individuals and Households program works. On the right is FEMA's graphic that they show kind of the flow chart of all their various programs and housing. And then on the left is just a step-by-step summary. So as you mentioned, it's expected that residents will have either insurance that will cover losses, or voluntary agencies can provide some initial mass care and emergency assistance. They apply to FEMA. FEMA and the states will look at all their non-SBA dependent assistance, and then they are asked to apply with the SBA. And then if they're approved for a loan, then they move on from there. If they're denied a loan from SBA, there are some other items that they can receive assistance for. And then it falls back to our voluntary agencies to help meet any unmet needs that FEMA, the state, or the local communities cannot provide. And next slide. All right, and that is the end. That's just a brief overview of all the programs available in individual assistance. If you have any questions, my contact information is there. There are also a few links to resources as well. I know that our public information officers and some of our other partners are working to make sure that the information for residents is available on the earthquakes.utah.gov website. It's set up so residents can click on there and find out what the phone numbers are they need to call to register for the various programs. So, any questions?
Thank you, Janna, for that presentation. I'm not hearing any questions, so we'll go ahead and move on to the next item. It is fire season, as you're all very well aware. Just hats off to everyone that has been engaged in this effort. We've had some pretty serious fires already. We know it's dry out there this year, and just remarkable responses from agencies all across the state, local and state, federal partners. Just so impressed with the way things have been handled. It could have been much worse this year, and they've been responding very valiantly. So with that, I know we've had several FMAG requests, and Brad's here. Brad Bartholomew is here to talk to us about some of those issues. So Brad, go ahead.
Yes, thank you. You know, knock on wood, fire season's not over. There's still a lot of fire season left ahead of us. So I'm going to talk about the FMAGs and then our post-wildfire team. John, if you want to go to the next slide. So for those of you who don't know, the fire management assistance grants through FEMA are awarded to try to avoid emergency declarations or major disasters. What FEMA looks at as the threshold for FMAGs is if there's 100 homes or more, usually is what they're looking at. They won't come out and say that 100 homes is the threshold, but that's the official threshold of what FEMA is looking at when declaring FMAGs. So if there's homes that are immediately affected by the fire, usually they're looking at evacuations. Sometimes they'll also consider other infrastructure, water, power lines, gas lines, stuff like that. They'll take those into consideration as well when looking at declaring FMAGs. The FMAG, that once the FMAG is declared or granted, then the fire is now covered 75% by FEMA, 25% by the state and locals, and it covers all suppression costs, anything related to putting the fire out, which also includes responding to the fire. You close, if you have to do evacuations, those are cost eligible. Sheltering, closing off roads, anything like that. So far this year, we've had 3 FMAGs, 2 on the same day, June 28th. That's the first time Utah's had 2 FMAGs on the same day. A couple years ago, we did have 4 FMAGs in 1 week. So we're not quite there yet, which this is all of our FMAGs this year, let's hope. After the FMAGs declared, FEMA will work with forestry fire state lands in determining the time frame of the FMAG and what is eligible. So you can see that for the canal and nose fire, they've already determined the time frame of the dates of the costs are eligible. So for the nose fire, costs incurred June 28th to June 30th are what's eligible in the FMAG. There's always costs before and after that. Fires just don't go out right away. But FEMA is more concerned about when the fire is an actual threat. So once that they believe the threat's no longer there, then that's when the FMAG ends. BAO, we have not sat down with FEMA to discuss the incident period for the BAO yet. Next slide, Janna. So in working post-fire, one thing we've noticed over the years is that there's all these different federal and state agencies that show up or call and have programs that help communities recover from a disaster after a fire, recover from a wildfire. And you know, a lot of times the communities are pretty new to wildfires, and and they're still trying to fight the fire or to recover from fighting the fire. And then all of a sudden you have all these federal and state agencies calling you, emailing you, showing up, saying, hey, we've got all these programs. That can kind of get overwhelming and things get missed. And a lot of times the agencies aren't talking to each other. So you have NOAA's out there doing their thing, while DNR's out doing their thing, and they might they could benefit by working together. And so a few years ago, after we've had several large wildfires, we decided to set up a Utah post-wildfire team where we invite all of the state and federal agencies to come together and meet with the community to discuss what each state and federal agency is doing, and how that helps the community. And this gives the community an opportunity to ask questions from each agency, and it also allows each agency to see what the other agencies are doing. Every time DNR is in the room, they're mostly focused on reseeding. They'd also do short-term fuel reduction or debris flow reduction projects. And a lot of times they don't, BLM or the U.S. Forest Service, they don't coordinate with them. But if we get them all in the same room and BLM's there saying, hey, we're going to do this much seed and we're going to do it here, and on this day, DNR all of a sudden sits up and says, wait, what kind of seed? When you're doing it, how can we coordinate so we can do our seed with your seed? So these post-wildfire meetings that we started last year and have done 3 so far this year have really been beneficial for the communities, as well as for the state and federal agencies, to make sure that we are all coordinating and trying to just put our efforts together instead of having everyone just doing their own thing. If you want to go to the next slide, Janna. Some of the stuff that we talk about and focus on at our meetings is the flood after fire. Every time there's a fire, it rains and there's flooding and debris flows, and heavy mudslides. One of the things that we're working on is develop, and we're pretty close. I think we'll have something. We wanted something by this summer. It looks like it's going to be the fall, but we're putting together some pamphlets as well as a website for communities to go to and to use that will have all of access to all the information for post-wildfire. So once there's a wildfire, we can share that website with them. They can go through the website, find contacts on the different agencies, find what's available to them, what can help them best recover post-fire. John, if you want to go next website. But one of the things that we have now, post-wildfire, or post-FMAGs, is the Hazard Mitigation Grant Program post-fire. That's also called the HMGP. So this is something new in the last couple of years, where now for every FMAG that we receive, we also receive $454,432. And that is to do wildfire mitigation. It's a 75-25% match. And we really try to focus on projects within the area that was affected. If we cannot find a project within that area, we can then look statewide, and WRI is always looking for seeding money. So we've given them quite a bit of funding to help with the reseeding program. John, if you want to go to the next slide. I think that's all I have. Any questions? All right, thank you.
Okay, great work. Thank you so much, Brad. And yes, we know there's a long fire season ahead of us. We appreciate all the bullets that have been dodged, and again, the great work of everyone. And we're praying for more rain as we move forward throughout August. So, any questions? I didn't hear any. Okay, with that, let's go on to the next item. Will Lusk with Cache County, update on some previous action items.
Thanks, Lieutenant Governor. Quick update on the Utah Special Needs Registry. When we met last December in the closing moments, we made a proposal that we put together a working group to take a look at the Utah Special Needs Registry and see if we could get it working a little better in the state of Utah. Once more, because of things that were happening in the Division of Emergency Management, as well as the status of the Special Needs Registry itself, there were some issues and some questions being asked about the future of the Special Needs Registry. So one of the purposes we wanted to do as a working group was to sit down and take a look at the status of the Special Needs Registry, as well as take a look at what was working well, what was not going so well and could be improved, and then look at what we could do for the future to get it working even better. We met in Chris Hamlet's office back in, or Janna Whiteside's office back in February as a small working group, and came up with some ideas and some thoughts that we wanted to share with the committee today on where we were at and where we were going. One of the projects that the committee took on was a survey of emergency managers to find out how many across the state, one, knew what the Special Needs Registry was, had ever used it, had any questions, concerns, or problems with it, and to see if moving forward, they would be willing to put time and support behind improving it and making it a better tool. Long story short, the results from that survey gave us all kinds of different results. Bottom line is one, yep, the Special Needs Registry is not very well known or utilized currently by emergency managers. Two, there is an ongoing need on a yearly basis that the data inside of it be upkept and maintained. And then also the need to train new emergency managers on it to be aware of what the tool is, how it works, how it can be applied both before and after disasters to become useful. So as we met in working group back in February, we came up with 5 things that we'd like to do moving forward. One, we want to put together a working group out of Region 1 and others designated by the Division of Emergency Management to work with a software provider that the state is contracting with to revamp the site itself, to look at how we might make it a little more user-friendly, as well as to change the reporting features on there to make them a little more user-friendly as well. We put together a proposal for initial group to meet with the software designer made up of 5 emergency managers out of Region 1, as well as a couple that the state wanted from around the state to give input into that process. We did not get any time to move forward on that. COVID-19 broke out on the first week in March, and so right now we're still sitting at that point, ready to move forward and hoping that this will subside or get to a point where we can move forward on that project. Once the site was maintained, we were going to beta test it in Region 1 and work out any bugs or user problems. And then the goal was to move forward on a strategy for initial, yearly, and ongoing training for emergency managers statewide. And then last but not least, look at a way to maintain the data. The true value of the special needs registry is the data that it maintains, both for the local emergency manager as well as statewide. I realize it's not a completely comprehensive site because it is based upon individuals and facilities going there on their own or at that point working through 211 to put their data into it. But on the flip side, it is better than nothing, as well as it does give the local emergency manager some idea when they have to do an evacuation of both what facilities are in a particular affected area, as well as who they need to contact or give them a contact to work with those individuals or facilities needing extra help. We did not come up with an answer for the best way to do the continued updates and renewal of the data. Hopefully when we meet again, we can move that one forward a little bit more or explore some more ways that might be useful, whether we use the emergency managers who participate in EMPG, or we let the emergency managers who are using the system just make the telephone calls and update the data on a yearly basis that affect their county or our community. And then last but not least, once the data is maintained like any other tool, the goal would be to incorporate it into exercises and events. Like any tool in the toolbox, if it never gets out of the toolbox or is never used, it becomes useless, hard to manage, and extremely non-useful during a disaster. If this tool is going to both become a well-honed tool in the hands of a local emergency manager, it does need to be used. We did not come up with any definites on both training, yearly use, and exercising, but we'd like to explore those in future working groups. Anyway, long story short, that is where we're at on the special needs registry. We appreciate the opportunity to work at this time on this project. Lieutenant Governor, thanks for the support, and I don't know if anybody else has any questions on it at this time.
Well, thank you, Will, for taking this on and for your leadership. We very much appreciate it. Great work that you've done, and know there's still work to be done. Any questions or thoughts?
Yeah, this is Joe Miner. I wonder, did I miss, do we have data as to how many people have taken advantage of self-identification of special needs, or if family members do it for them? What kind of numbers do we know about its utilization so far, at least getting on the registry?
Yeah, I don't have access to that data at my level. Certainly UDM, and most importantly, Sheila Curtis with the Division of Emergency Management has that ability to look at all the data within the site. Right now, most county emergency managers can only view their county data and the county facilities. City emergency managers can only view their city data and the facilities within their city jurisdiction. So if you want a statewide look, you'll have to either get with Sheila or Janna to get that information.
Very good. Okay. Yeah, this, I know we always talk about identifying people in our communities that are going to need special help during a disaster. And this is a great way to do it. And it's good to promote this, and I will do my part now that I know about it. Thanks.
Thank you, Dr.
This is
Miner.
Audrey
Anyone?
Pierce. I do have I know, I mean, as we try to track a lot of different data in emergency management, that maintenance of those records is pretty hard to handle. But may I suggest that as you're trying to get more information other than just larger facilities but information that would pertain more to individuals, that we can maybe look at business partnerships. Utility companies usually hold records for people that they can't shut off power to because they have specialized equipment or something in that house for medical reasons. And those would be people that jurisdictions would want to know how to help, because they wouldn't have other people there to help them like you would at a facility. So just something to consider.
Yeah, that's a great proposal, and be happy to go that way. One of the questions that has been brought up in the past when we looked at that, Aubrey, was the willingness of the business to share that information. Many times industries look upon their information as just that, and wanting to pull it together with other databases, it has been hard. Certainly as emergency managers, we need and are in great need of that information, but so far attempts to get different industries to share data has not been very successful, which is why this one really contains the special needs registry information only, and is a user opt-in system, trying to get people and permission to use people's data from different sources. I'm sorry, it's kind of like pulling teeth at the dentist's office. It's awfully hard.
Agreed. That's why I was hoping you'd have more pull than I do on my own.
Oh, sorry, maybe we can get the new governor to work on that one.
Let's talk after November. I
could see a lot of people not wanting to admit their special needs, but their children or relatives may want to enter for them the information. And I'm imagining, I believe that's possible, is it?
Yeah, right now the way the system is configured, yep, an individual or somebody representing an individual can initially go in and put that information in there. It also can be put in by the 211 system. They've been doing it in the past and have done a wonderful job getting it in there, and or also every year returning telephone calls to those that are in the system to make sure that information is still current. But if you go to the system and let's say you wanted to put your information in there, you can follow the icons and put information in, whether you do it for yourself or you want to do it for someone that you love. I think right now both ways are actually permitted by the website.
Excellent, thanks. Thank you.
Hi, this is Annette. I just have a comment. We have a Camp Christopoulos that's just up the canyon from us, and that's a special needs camp in which people from all over the country come in addition to those folks from Utah. I wonder if it would be worth partnering with them in order to gather some data, especially local data, but that's also a consideration if there is a disaster in that camp that were to occur. There would be hundreds of special needs folks that would need evacuation.
Yeah, that would be a great opportunity to partner with the county emergency manager who has access to that data and see if that facility is already in there, or you could check with Sheila or the state division of emergency management and see if they could find that facility in there. And if not, absolutely, why not put it in there and allow that also to be planned for and worked with.
Thank you. Anyone else? All right, Will, anything more from you?
That's all I have on special needs registry.
Okay. All right, thank you, Will. Really appreciate that. Let's see, Jess, anything else before we move on to the COVID-19 roundtable?
Thank you, Lieutenant Governor. I don't think so. We can head right into that.
All right, well, a little bit's happened since we were together back in December. We are in the middle of a global pandemic, as you can tell from the, if you hadn't heard from the nature of this very meeting. It's been from really the beginning of March onward. It's been just an incredible journey. We recognize that there are many people who have suffered both health, obviously, and economically, as well as we are trying to work our way through this. Grateful for everyone on this call who has been intimately involved in our response, both locally and at the state level. We've gone through many different iterations. We've made some mistakes along the way and gotten some things right. And we wanted to have a roundtable discussion about that, just to lay a little bit of the groundwork from a response perspective. We started out in early March with the Utah Coronavirus Task Force. It was put together. Some members of this call were included, those working on the public health side, the emergency response side, every segment of our state being represented there. We had faith-based representatives, community organizers, the economic leaders, just a great group of people. And their response was to help us build out the infrastructure. It's really twofold. One, to build out the infrastructure to help with this response, and two, to advise the governor on that response. Over time, that organizational structure has been replaced with our unified command, with Jess in the lead there. And that has really, again, a much more complex and nuanced, enormous group of people. I think there's about 150 people that are directly involved in the unified command, working on everything from acquiring the equipment that we need to testing. to making sure that we have beds available for those that are ill. Again, working on the economic enormous response there, and then the legislature has had a couple special sessions since we last met. Of course, they had a regular session since we last met, and then 2 special sessions in which they made some changes as well, and they put together a commission that is tasked with advising the governor, so really replacing the task force on that piece as well. And the governor has relied very heavily on unified command and his senior leadership team as he has made decisions moving forward. And so I wanted to turn some time over to Jess, and then we can open it up for discussion or questions. So Jess, go ahead.
Well, thank you, Lieutenant Governor, and you've recapped that very well. It's hard to believe that that much has occurred or happened since our last meeting. And since we've been here, and I'm just looking at the screen here, there are several who have been directly affected by this or involved one way or another, and we thank you for your service and being able to truly fight the battle on the front lines, as we say. And knowing this has been very impactful to many people and agencies, both far and wide, local, state, county. It's been very impactful as we continue to work through these issues, and taken a lot of cooperative effort to be able to come together in these emergencies, in an emergency setting, and realize that we've never been through this before as a state, at least in 100 years. And so, it's been incredible to see the effort come together. As much had been written as we go, but also relying upon what many of you have trained so well for throughout your entire career, and be able to help guide us through this effort in an emergency setting and emergency situations. So, to add to that, any much more than what Lieutenant Governor's so eloquently described and put it, but it really has been a Herculean effort. We're not out of the woods yet, and we all know that we got a little ways to go still, and opportunity for us to continue to pull up our bootstraps every single day and continue to get to work and to fight the battle, knowing that a lot of people are tired and a lot of people are about had it with it. But this is an opportunity for us to truly shine as a state, as we'll continue to come together under such a great leadership of the governor and lieutenant governor in this effort, and being able to move things forward in the proper way. So, unless there's specific questions as we get into this, Lieutenant Governor, not much more to say to that. So thank you.
Thanks, Jess. The only thing that I would add is as we transition from summer to fall, of course, we've seen a dramatic increase in the case counts, a little less hospitalizations, and those in the ICU, obviously things that we're watching very closely. We have had some good news over the past 10 days, as we've seen not just a plateau, but a decrease in cases. The 7-day rolling average has decreased from a high around, I think, 630, maybe 640, maybe even a little higher than that, down to wherever we are now, 530, 540, somewhere around there. I do suspect that as happens, well, 2 things that happen. One, with a holiday weekend like the one that we just had, you've noticed a decrease in not just case numbers, but testing numbers. People tend not to go and get tested as much on holiday weekends, and so while our positivity rate the last 2 days has still been around 10%, our case counts have been low in the 400s again, which is good news. I do suspect that we had a lot of people go and get tested on Monday. And so tomorrow and Thursday we'll probably see some high numbers again, but it's those 7-day rolling averages that we pay the most attention to, but really need to get those numbers down as we work with our hospital system. When we're above around 500 cases per day, just the law of averages, it's a math problem at that point. We slowly start to increase the beds, the hospital beds that are in use, and so we want to be careful there, and we're working hard to get those numbers down. Again, excited to see some improvements over the last 10 days. All of that being said, as we're looking to the fall, and the possibility of vaccines coming our way. We've had meetings, and you've read the headlines with vaccine manufacturers. There are several of them that already have agreements with the U.S., with the federal government, to provide hundreds of millions of doses of vaccine, some of them as early as October, which is really unprecedented. We've never seen with this Project Warp Speed that's moving forward, where they're actually producing vaccines and ramping up production of vaccines that we don't even know if they work yet. The outlook is very good, as we've seen some of the tests that have been run now moving into the phase 3 testing, kind of large scale testing, where tens of thousands of people will actually be vaccinated, and over the next couple of months we'll be working closely. I say all of that just to say this, that a vaccine is only good if we can get it to the people of the state. And so over the next few months, working with local health, we're going to want to be prepared for mass vaccinations, for the ability to get those vaccines out to people as quickly and efficiently as possible. At the same time, we really want your help to convince people a lot more than normally do to get flu vaccines this year. When we talk about overwhelming our healthcare system, nothing would be worse than having, of course, a coronavirus, a pandemic outbreak, and large amounts of people getting the flu at the same time and taking up those hospital beds. And so we're having discussions. We're going to be pushing really hard to make sure that we are getting people vaccinated for the flu early, and as many as we possibly can to prevent the different strains of the flu from being passed around, and those that do get them hopefully having symptoms that are not quite as serious, so that we don't double up during this very critical fall season. And with school getting back, we're still working very closely with local districts. Their plans are due to the state on August 1st. We will be reviewing those plans with the State Board of Education and the superintendent, and making sure that we have safety precautions in place. We're working hard to increase testing capacity every day and testing turnaround times, all of which are very critical to the health and safety of people, and of course to beating down this pandemic. So a lot of moving pieces still, and a long way to go, but Utah is doing remarkably well, all things considered. I know Jess and I would be happy to answer any questions that you have, or any comments, anything that you would like to share on this issue.
Yeah, Lieutenant Governor, I, representing public health, definitely have to weigh in on this and want to.
Please do.
As you know, for the 5 years I've been in this position, I have said to cabinet members, look, you're all doing public health. Every one of you in your area of expertise and interest is a critical part of public health. And this has been extremely important here with a COVID response. Really, all hands on deck has been extremely helpful and important. You know, we talk about social determinants of health and how much many things that we don't think of as health play a huge part in people's health, their mental health, emotional health, physical health even, are employment and jobs, and not being isolated, and all of those have been an important part of this response. And so it really does require a balance between the actual physical health of the infections, which we certainly try to prevent, and also the health problems created by being unemployed and isolated and stressed in many other ways. And so I think Utah has done a very good job at balancing that. Our neighboring states, Arizona particularly, and Idaho, and then of course we know the large states, Florida, Texas, and California, have had huge problems. Hopefully we're going to avoid that. There's been concern with our increased cases that that it's coming here next, but so far it looks like we're plateauing, maybe even decreasing at a higher level than we certainly were, but decreasing. But need to remain vigilant as schools open and as flu season. You know, it's not just influenza, but childhood immunizations have been neglected. I mean, another real concern is vaccine preventable illnesses among children, because so many children have gone without immunizations here in the last 5 or 6 months. So a lot to still work on, but I think so far, like you say, we're doing well, but it's going to require everyone to be vigilant and participate. So thank you.
Thank you, Dr. Miner. And anyone else?
Lieutenant Governor, if I may jump in there too. You know, it's incredible as we've actually, just thinking back what we began with several months ago, and for this group to know, I mean, we established a very lofty goal of hitting 4,000 tests in a day, and knowing that that was a key component to getting out on the forefront of this, knowing now though that we are well above that on our daily test counts by and large for the last little while. Some days, you know, upwards of, I don't even know what our high is now, but 7,000 plus, but most days about 5,500 or 6,000 tests. And so we've hit some, I just wanted to mention, we've hit some very key marks from where we began, and having to pull a lot of things together. And part of that really credit to Dr. Miner and the Department of Health, and really coming around on several issues of being stretched in many different ways than what we've ever seen before. And so anyway, just wanted to mention that. You know, one of the questions too that keeps coming up is around the issue of mask wear, and are we starting to see the difference of what mask wear is doing voluntarily? And in short, the answer is yes, we are seeing a difference. And what was about the 1st of July, very informal surveys, but about the 1st of July, we were seeing about, in some of our observational studies, of a 25% wear compliance, up to which is about 60% now mask wear in public. And so with that, what Dr. Miner just mentioned, we're starting to see that plateauing, and we're starting to see a little bit of the decrease based on just the compliance of people willing to have a little bit of inconvenience out in public by putting on a mask for the sake of other people as well as yourself. So that's good. It's good messaging, and it's good direction that we need to continue to push, just for the right thing to do for the right reason.
Very good. You know, businesses have a lot at stake here. They don't want to be shut down again. The rest of us, the public, don't want them to be shut down again. It's been thrilling to see so many businesses say, hey, you don't come into our business unless you're wearing a mask. It was in March, I think, when I said, you know, our businesses need signs that say no shoes, no shirt, no mask, no service. And they're really finally coming on board and doing that. And it really makes a difference. And it's for their own self-preservation and all of our preservation, to keep the stores open, the economy healthy, to do that. Because it really it's actually, there's mounting evidence that it's even more and more important than we even thought it was. Probably 80%, if everyone consistently wears masks, you're decreasing the spread by 80%, which is as good as vaccine. It's just that vaccine has extended effectiveness, and masks require it to continue every day. So that's what's critical here, is that we do get a vaccine eventually. But in the meantime, if everyone wear masks, it's essentially effective as vaccine. So we're there if we just get people to cooperate. Yeah.
Anyone else?
Yeah, I have a question. Has there been any conversations regarding the distribution of vaccines whenever they do come in, given the there's certain ethnicities have an increased morbidity and mortality.
Yeah, there have. We've had those initial discussions. Many of our local health departments have plans in place dating back to, well, I mean, a long time. H1N1 obviously was the last one, but those conversations are being had now. We're talking about, what kind of funding we need to get those set up, and you're absolutely right. For those that have followed this, several of our multicultural communities have been hit with much higher rates of transmission than they are a percentage of our population. So they've been overrepresented in case transmissions, hospitalizations, and mortality rates. And so we really have to focus on those communities again, and we're continuing to increase our messaging out there. But there was a gosh, I'm trying to remember if it was a New York Times piece recently that showed that testing facilities are much more, they exist much more in white neighborhoods than in our multicultural communities across the country. And we've done a really good job of standing up mobile test sites and getting testing out in communities over the especially the past month and a half. We've seen a huge increase in the testing we're doing out there, but the same thing applies to the vaccines, making sure that we're getting the right materials out there in their languages, in a form that they're able to understand the importance of this, so that we see high vaccination rates amongst everyone in the state.
Thanks.
You're welcome. Anyone else?
Lieutenant
All
Governor,
right.
this is Jeff King, Jordan Valley Water Conservancy District. I appreciate your comments about getting the flu shots early this fall. Do we have any idea when the serum will be available? That's one of the big questions that I would have. Wanting our people to get shots as early as possible would be great.
Dr. Miner?
Yeah, it's usually available early September, sometimes even before. But yeah, by the 1st of September, it should be here, unless, through the many years, occasionally it'll be delayed, even to late October. But almost always by early September, it's available. And yeah, the sooner you get it, the better, just to decrease the confusion and complications on top of COVID. Yeah.
And Dr. Miner, you can correct me if I'm wrong, but if my memory serves me right, we usually see about 40, maybe 40+% uptake in flu vaccines. I know we'd love to get that up into the high 60s or higher. Does that sound about right?
Yeah. Yes. In certain age groups, it's better than that. Seniors particularly. But the flu immunization is recommended for everyone age 6 months and older. And we're lucky to get to 50%, as you say. It's probably about 40% of the entire population. For people 65 and older, we usually are up around 65–70% use, and that's considered very good for that age. But but influenza affects particularly very young and the elderly. Fortunately, the young and young adults are spared with the COVID risk, and that's one reason why, with our increasing numbers, actually we've seen hospitalizations stay level or even decrease a little, and mortality rates actually go down nationally, but especially here in Utah, because I think older individuals are getting the message and protecting themselves, or others who are high risk. And the highest numbers of cases are among people 15 to 25 or 25 to 45. That's where a very large majority of our cases are occurring now, because they feel invulnerable and are taking less precautions.
Thank you. Good question. And again, you'll see some public service campaigns to help convince people and remind people to get those vaccines. My wife got influenza A this year, the last week of February, I think, into the first week of March, and it was rough. And she was basically quarantined during that time, and then everyone got quarantined after that. So she had spent an extra long time at home and doesn't want to do that again. So. Be careful out there, everyone. Just a reminder that still most of our spread, 60% is family transmission. So as you're getting together with the summer waning in those family groups, remember to wear masks when you're in close contact. Try to be outside. Keep 6 feet of distance between even those relatives that are coming around. Just assume the crazy uncle brought coronavirus this year. So, all right, anything else? All right, seeing none, I'm not going to ask for a motion because it's always awkward on these calls, but we will just go ahead and stand adjourned. Thanks, everyone.
Thank you.